So the horse's lungs, on average, when they're resting, breathe like 5 liters. Every breath, they breathe 5 liters of air through it, like they're moving that much capacity, which totals to about 60 liters per minute. But when they're running, they can breathe up to 2,250 liters per minute. Compared to us when we're running, it's about 240. So they can move a lot of air. So it's important to keep them healthy. There are different types of respiratory diseases. I chose one from infectious and one from the allergic. There is equine influenza virus, which basically damages all the lining within the trachea and bronchi, and it causes there to be further infection while it's healing, and it's highly contagious, and it can cause the horse to be depressed. It won't want to eat. It'll have a hard time breathing. It'll have inflamed limbs. The eyes will be swollen. Lymph nodes will be like clogged up and swollen. So it's basically kind of like flu, and it can last 2 to 3 weeks or longer, and there is a vaccine. And then for an allergic one, there is COPD, which is chronic obstructive pulmonary disease. And what it does is it's just a full-blown allergy to the dust in their feed or where they live. It causes inflammation and mucus to so over here you have a relaxed, like a normal airway. So when they have COPD, it inflames so much that it's harder to breathe, and then you add mucus on top of that. There was one case where a horse actually suffocated. It had so much mucus and inflammation. It can cause coughing, flared nostrils, hard time breathing, and weight loss. And they'll have a heave line, which goes from their hip up to their lower ribs. And the best way to treat it is to remove the horse from what's causing the issue, and then there is medication to remove mucus. Should we go back in? I feel like I kind of rushed. Sorry, I can't read it verbal as well.
You're good. You're good.
So I also decided to do hoof cracks because it's a lot easier to figure out what's wrong with a horse. So with the hoof, it pretty much affects the entire horse because no hoof, no horse. But mostly bone structure. So the hoof can actually crack. Horizontal cracks are usually caused by abscesses that are underneath, and it causes the white line to stretch until it finally bursts. And then it'll drain out through the top, which is the path of least resistance, which causes a break in the forming of the hoof, so it causes cracks that kind of go across, and they can range from super deep, super long, short, that kind of a thing. They do grow out, and towards the end of their growing out, vets or even yourself might want to stabilize it so it doesn't break off prematurely, because that can cause uneven footing and even further problems. The horizontal crack itself will not cause lameness. It's usually the abscess or what caused it that does. And Epsom salts can help with the abscess stage of having horizontal hoof crack. And then vertical cracks are usually defined by where they're located. They can crack from the bottom, which is usually caused by poor shoeing, or they can crack from the top, which is also usually caused by abscesses or uneven pressure. So when you have a shoe on the horse that is either too small or it's not put on correctly, it can shift and cause the back of the heel to split straight up. Some of these do cause lameness, especially heel cracks and quarter cracks, which are on the sides because that's where it flexes when the horse steps down. And you should seek help from your vet if there's any hoof instability, like if you're actually able to, like if it's moving when it's not supposed to. If there's pus, blood draining from it, because they can get pretty deep, which damages the underneath. If you can kind of tell because the frog, if you can tell that the coffin's moved because of it, that'll cause a lot of issues. And if there's any like injuries, open injuries or wounds around it, just to take it and get it fully cleaned up so it doesn't cause further damage. Best treatment for both of them is just to kind of stabilize them, clean them if needed, and let them grow out, and they'll eventually be trimmed off. So I brought treats. I brought a giant one, which looks like a hoof with different cracks. I'll let people pick if they want a huge one or a small one.
I think everybody. Yeah, it was. Yeah, that's what I did during when everybody was writing the second part. I lined it up perfectly. Oh, I should probably follow around with the treats, huh? Dude, she's doing good on time, though. I'm just gonna make this her last 4. Anna, drag it out 4 minutes, girl.
Oh, I talked way too fast.
It's okay. What piece are you gonna take, John? A big one? You gonna take a big one or a little one?
Probably small.
Katie, stop.
I was trying to track out your time.
I talked a little way too fast for that.